Mother kama mother kuna pressure, achana naye. Kama mzee ni mtu wa maji sana pia, achana naye story. Yeah, and if they're above 55 years, lenga hiyo story. So my sister was the one who was really willing. My sister was ready for everything. My younger sister, ako the age of 21 years. Yeah. So tukakuja tu hivyo, tukaanza tu matest na yeye from 2019.
Sasa serikali imesema wale watu wenye wako na diabetes wako na a very high risk ya kupatwa na COVID-19. How does that information, as someone who is living with diabetes, who has had a kidney transplant, how does that information make you feel?
Inatupanisha kwanza, first of all, inatufanya hiyo ina worry sana. Such that you are limiting people kukuona nini, you can't move out. The only place inatokaga hapa hivi kama naenda hospitali. Yeah. So unaona sasa ni nzuri. In the long run pia unaona pia hivi diabetes ina affect. Wale job nilikuwa nafanya January walikataa tena kuniregesha job since that January. So unaona pia hii mbakini pia inafanya I'm becoming a liability to people and to companies pia. So hii corona hii ina affect sana because unajua everything una panic. Ukiambia mtu ameenda underlying factor kwanza diabetes. So inasemekana corona inapenda watu sukari. So unaona sasa inatupatia it is making us to be in a very high panic mode always. Yeah.
What happens when you visit friends? Huwezi kula, huwezi nini? Hata hu visit?
Si visit. Mimi ni hapa tu. Yeah. Ku visit friend bado. Unajua say I'm 6 months old. 6 months old since I did the dialysis, the kidney transplant. So bado sijaanza kuzunga sana.
Umetuambia utoki nje sana, pia una limit wale watu wanakuja. Kuna vitu vingine extra unafanya kujiprotect?
Yeah. Unaona kama kuna hiyo sanitizer hapo, mask ni mimi kama dress code yangu. Pia naangalia pia diet yangu, pia unajua pia diet yangu ina matter pia a lot. Yeah. So unajua protection anza tu na wewe kwanza peke yako. Wezi tegemea watu wengine kulinde kama wewe ujilinde peke yako. So hata yule mtu ambaye nakaa naye hapa hivi, yule ambaye tumepatana naye hapo, pia lazima unajua nikimwambia akitoka lazima nimwangalie amevaa mask. Akiingia lazima sanitize kwanza. Yeah.
Naona dawa hapa zimejaa, ziko mingi. Nini yako iko aje? Schedule yako ya madawa, ya chakula?
Ya madawa. Ya madawa yangu, dawa kwanza first tablet naanza kumeza 6. Unajua sasa unasahau. So unaweka alarm. Niko na alarm ya 6, niko na alarm ya 7, niko na alarm sasa umesikia na saa 6, na niko na alarm ya 6 in the evening, na kuna alarm ya 7 pm, na kuna alarm tena 10 pm. So unaweza pata these drugs are timely. Ufai kurukisha tena dakika 5. So hapo hivyo kuna mchanganyiko wa insulin ya diabetes, na pia kuna za pressure, na pia kuna za kidney. Yeah.
Okay.
Haya, hii nayo ni acidity. Hii ni acidity ya kupunguza acidity in the body. Hii ni ku increase, ku reduce potassium in the body. Unajua pia another thing, when you have so much potassium in the body, ina affect pia kidney. It leads to kidney failure pia. Hii pia ni nyingine pia ya tumbo, ya acidity pia. Hizi za kidney sasa hizi. Yeah. Challenge moja ya kidney drugs ni they are very expensive. Hiyo ndio the first disadvantage ya kidney drugs. They are very expensive. Na unajua sasa vile tu niko hivi jobless, it's very hard. Unajua ukiwa jobless hauna medical cover. Yeah. So ni hiyo. Hii pia ni acidity pia. Hii pia na mezaga jioni once in a day at 6 pm. Hizi nazo za pressure. Unajua nimekuambia pia niko na high blood pressure. Hizi na meza 6 in the morning. 6 in the morning. Pia kuna hii na meza 6 in the morning. Saa 6 kama pressure iko juu, na meza pia 10 at night. Hii ni hydralazine. Hii ni kwa sasa ni ya kuspray hapa, lakini kazi yake ilishaga. Hii ni prednisolone, ni steroids pia. Ndio kusaidia pia kidney functioning pia hizi. Yeah. Hii inaitwa amlosan, pia ni ya pressure. Yeah. So unaona these drugs zote hizi pamoja na cost kama over 60,000.
Thank you so much for staying with TV47. This is Body Garage. My name is Tracy Mukami, and today I want us to understand kidney diseases, what causes them, and what next for patients who suffer from kidney disease during this COVID-19 era. Now, we are talking to Dr. Hussein Baga, who is a consultant physician and nephrologist here at Mpisha Hospital. Thank you so much, Doc.
Thank you.
All right. One of your patients, actually, his name is Jason. We have spoken to him here, and we have had issues that he has been dealing with and how his condition has evolved over time. Maybe we can begin with just trying to understand, for one person to have diabetes and hypertension and kidney disease.
I first met Jason in 2018. He was referred to me by another colleague of mine, and he is known to have had diabetes for some time, and was also discovered to be having hypertension as well. And during one of his routine checkups, he was found to have chronic kidney disease. So that was when he was referred to me, and unfortunately by the time he came to me, he was already in end-stage kidney disease requiring some form of what we call renal replacement therapy. So technically his kidneys had failed, and his body was not able to remove all the toxins that the kidneys normally do. So we had to start him on hemodialysis, which is a form of therapy for patients with kidney failure. Now, as you rightfully mentioned, that he was suffering from diabetes and high blood pressure. And unfortunately, if you are not careful, when you have diabetes and high blood pressure and they're not well controlled, one of the problems that we tend to get is our internal organs, especially the kidneys, the heart, they tend to get affected quite a bit. And unless if your blood pressures are very, very high and your blood sugars are extremely high as well, you will not know that your blood sugars and blood pressures are high, and you can be walking around with blood pressures as high as systolic blood pressures of 200, or your blood sugars can be as high as 20, and you're not feeling any symptoms. And this is why these two conditions are known as the silent killers. So eventually over time, if you're not careful and if you're not checking your blood sugars and your blood pressures and you're not controlling them and visiting your doctors regularly, it can lead to what we call end organ damage. So it can affect your heart, it can affect your kidneys, it can affect your brain, it can affect your blood vessels. So patients tend to get what is called a peripheral arterial disease because of these conditions, which can lead to gangrene as well. So for Jason, basically his kidneys failed, and he had to be put on the form of renal replacement therapy, what we call dialysis.
And are these the only causes of kidney disease?
Diabetes and high blood pressure are the most common causes of kidney disease. This is in our setup in sub-Saharan Africa as well as in the first world countries as well. But of course there are many other conditions that can cause kidney disease and kidney failure as well. Things like genetic causes like polycystic kidney disease. We do have it here in Kenya as well. Things like kidney stones as well, if they're not discovered on time and if they're not treated appropriately, it can cause kidney failure as well. We have these infections, what we call glomerulonephritis, which normally tend to affect young children and young adults as well, mostly, which is an inflammation of the kidney. And if it's not picked up on time, because again, as I say, that these are going to be asymptomatic, it can cause kidney failure as well. And in our setup, of course, we have a high prevalence of HIV disease. This can also cause kidney disease, chronic kidney disease as well.
Then how will we know that you are potentially suffering from a kidney disease?
So they will have some very minor symptoms, like some people will come in with swelling of the legs or swelling of the face early in the morning, or they will feel tired most of the times. Now by that time, of course, quite significant damage has taken place. So once when you start having those symptoms, or if you find that your urine output has gone down, then you need to come and see a doctor and tell them that, yeah, these are my symptoms, and then the doctor would advise you to have your kidney functions checked out. Of course, if you have diabetes or if you have high blood pressure, then it is imperative that you go for regular checkups with your doctor, even if it's once every 3 months, because that way we'll be able to know that whether your blood pressure is being controlled or if your blood sugar is being controlled. And we do checks for the kidney function and for the heart as well on regular basis, depending on your symptoms. So at least once every 6 months or annually, for those patients who have diabetes and hypertension, we do checks. We check your urine, we check your kidney function tests in the blood. So that's one way of knowing it as well. The other way is, of course, if you have a family history of kidney disease, especially the genetic conditions that predispose you to kidney disease, like polycystic kidney disease, then you need to come for regular checks to see your doctor, because most of the times it is passed on in the family as well. Yeah.
The government has recently announced that people who are suffering from diabetes are at a high risk of contracting COVID-19. Yeah? Is it the same case for patients who have chronic kidney disease?
Yes, it is. They are at a higher risk, the patients with chronic kidney disease, for two reasons. One, as I mentioned, the most common cause of chronic kidney disease is diabetes. If you look at the studies that have been done, including the ones in Kenya, 3/4 of the patients in the dialysis units actually have diabetes. So when you are diabetic, your immunity is lowered because diabetes causes immunosuppression. So generally these patients with diabetes are at a higher risk of contracting infections. And this is why they always have to be very careful. Now when you have chronic kidney disease, it also causes immunosuppression as well. Now when you have diabetes and chronic kidney disease, you can imagine how much of immunosuppression that you have. So these patients always have to be extra careful, maintain their social distancing, wear a mask, make sure that they always sanitize their hands and wash their hands as well. Yeah.
All right. What exactly does the kidney disease, yeah? What exactly does it do to your body? So you have a patient who has presented with swollen legs and a puffy face, as you say. What exactly is not functioning in these bodies?
So the kidney has got multiple functions in the body. Yeah. All the water that we drink, that's excess water. So the body actually regulates how much fluid you take in, and the kidney regulates how much fluid remains in your body. So one of the functions of the kidneys is to remove the excess fluid from the body. Remember that the water comes in from the water that you drink, from the coffee, tea that you drink, even from the food that you eat. It also contains a certain percentage of water. Now if the kidneys are not functioning, all that excess water remains in your body, and this is how you tend to get the swelling of the feet and the puffiness of the face that I talked about. That's one of the functions of the kidney. The other function of the kidney is, of course, removing the toxins from the body. So the body is continuously generating toxins because it is active, it is metabolically active. So all those toxins that are being produced in the body, most of them are removed by the liver and the kidneys. So the kidneys play a very important role when it comes to removal of these toxins. So when these toxins are not removed, they accumulate in the body, and this is now when the patient with kidney disease starts feeling tired all the time. He starts having nausea and vomiting because of uremic gastritis. And if it goes on and if it becomes advanced kidney disease and the patient is not treated on time, it can also affect the brain as well, and the patients actually present with seizures and sometimes even in a comatose state as well.
All right. Jason mentioned that there was a time he was restricted to consuming 500 ml of fluids. Yeah. Does this mean that people who are suffering from kidney disease should not drink as much water, or what is the medical explanation to the reduced fluid intake?
So you see, for Jason, he was having end-stage kidney disease. There are different stages of kidney disease from stage 1 to stage 5. So stage 5 is end-stage kidney disease. Now by the time you're reaching stage 5, and there's a formula that we use to estimate how much your kidney is functioning at. Normally when your kidney is functioning at less than 10 mils per minute of your estimated glomerular filtration rate, we have to start you on dialysis, because by that time there's a lot of toxins that are built up in the body. Now, there are some patients who, by the time they're reaching stage 5 chronic kidney disease, the kidneys shut down completely and they don't produce any urine. Now, the most ideal situation would be to get a transplant immediately when that happens, but of course we know that it is not feasible because one is that patients do present late to us. Number 2, we have to get a suitable donor. Number 3, there's a workup done. So it takes around 3 months for us to actually do a transplant for those patients who are ready. Remember that there's also the financial aspect to the transplants as well. So for those patients who come in late and they don't have any, their kidneys have shut down completely and they're not making any urine, they're started on dialysis. Now, our National Hospital Insurance Fund only caters for twice weekly dialysis, whilst for a kidney it's supposed to be functioning round the clock. Even as we are talking right now, our kidneys are functioning. They're filtering the fluid, they're filtering out the toxins and maintaining the electrolyte balances and the acid-base balance as well. So if somebody is only doing twice a week dialysis or sometimes thrice a week dialysis, remember that the patient is still eating food, is still drinking water, so all of that tends to accumulate. And if you're not making any urine, there's no other way for us to lose the excess fluid apart from sweating, and we don't tend to sweat a lot because we don't exercise too much. So in such patients we do tend to restrict their fluid intake so that they are comfortable until the next session of dialysis. Sometimes it's very difficult because we do tend to get calls at night that the patient has come in with significant volume overload, the patients cannot breathe, and we always advise them to reduce their fluid intake, because if you're only doing twice a week or thrice a week dialysis, there's a very high risk of you getting fluid overload and your lungs getting flooded with excess fluid.
All right. Let's talk about dialysis during this COVID-19 times. Yeah, a lot of people have been avoiding hospitals. There has also been an increased load of patients from COVID-19 as well. Why is the balance between the kidney patients coming into hospital and the hospital as well being able to manage these cases?
All hospitals have their protocols on how to deal with dialysis patients, especially those who have the dialysis units. We have our organization called the Kenya Renal Association. It has written some guidelines, of which I was part of as well, for dialysis patients in this COVID-19 era. And if you look at MP Shah Hospital, we have our protocols in place. So we have advised all of our dialysis patients, number 1, not to miss the dialysis sessions. Number 2, to always inform us beforehand if they develop any fever or if they develop any difficulty in breathing, so that they don't come straight to the dialysis unit. They go to the accident and emergency or the casualty, so that they are assessed there first. And of course, I'm called to assess them as well. We have our dialysis being done in shifts as well, and our staff are all wearing the personal protective equipment as well. The patients, it's mandatory for all patients to be wearing their masks as well, and to sanitize their hands once when they enter. So all precautions are in place, of course, and this is why I always urge and all the patients who are undergoing hemodialysis or any other form of renal replacement therapy not to miss the sessions. It is very dangerous to miss the dialysis, because remember that the toxins build up in the body and it can be quite dangerous if you miss the dialysis session.
Okay. You mentioned the fact that COVID-19 and immunosuppression, yeah, they do not go hand in hand, yeah. When the kidney patients, the chronic kidney patients, are exposed to COVID-19, yeah, do you need to change their therapy? Because you mentioned that you use immunosuppression, yeah, that's what you called it, yeah.
So the immunosuppression is used for the transplant patients.
Or just
transplant patients. For those undergoing dialysis, we don't use any immunosuppression. But remember that naturally, because of the chronic kidney disease, they are immunosuppressed. Yeah. So they are at a higher risk of contracting the COVID-19, and when they do contract it, it does become a bit more severe than the other patients as well. So that's why we are extra careful with our dialysis patients.
All right. All these ailments sound like things that are very serious, yeah. And I think for every normal person, they'd really want to avoid getting to extents where you might require dialysis or require kidney transplant. How can we protect ourselves from contracting these diseases?
So, number one, remember what I said is that the two most common causes of developing chronic kidney disease is diabetes and high blood pressure. So, number one is 90% of diabetics are what we call type 2 diabetics. So it's a lifestyle disease. Okay, even hypertension, there is an element of lifestyle attached to it as well. So we need to alter our lifestyles. Most importantly, we need to exercise on a regular basis. We need to eat healthy. We can't just be eating junk all the time. We can't be ordering food just because of the fact that now food can be delivered home. So you don't want to cook. It's just KFC or Java or whatever it is, and burgers and sandwiches and all that. We need to learn how to eat healthy. We need to learn to reduce the amount of salt that we're taking. We need to learn to reduce the amount of processed food that we're taking. We need to learn to eat more of fruits and vegetables. We need to learn to keep ourselves more hydrated as well. And as I mentioned, exercise is very, very important. Every day for half an hour, at least 5 days in a week, is what the American Heart Association recommends. Simple walking, you don't need to join any fancy gym. Just brisk walking until you sweat. Number two, if you have a strong family history of diabetes or high blood pressure, it is very important for you to be checked on a regular basis. Yes? Three is that if you do have diabetes and high blood pressure, number one, please be very compliant to your medications. Please follow up with your doctors on a regular basis, and try as much as possible to go for regular checkups of your blood pressures and your blood sugars. That's very important as well. And if you already have developed chronic kidney disease, depending on the stage, then you need to see a nephrologist immediately, so that we can now then advise you on what needs to be done, because there are certain drugs that cannot be used in patients with chronic kidney disease. And avoid herbal medications. I know there's a lot of herbal medicines going around, and people tell you that, yeah, this can cure diabetes, this can cure kidney disease, this can cure blood pressure. There's nothing that has been found to work, and these things are not even tested as well. So what will happen is you will actually end up damaging your kidneys and livers as well if you start taking herbal medicines. There are the over-the-counter medications, the painkillers especially, like Brufen, diclofenac. Please avoid those, because those are not friends to the kidney. Those actually lead to kidney damage if taken for a long time.
Right.
Inappropriately.
Okay.
Yes.
You mentioned two things that I want us to delve deeper into. The herbal cures.
Yes.
We have, of course, there are many people out here who are purporting to sell these cures, yeah?
Yes.
But is there nothing that we can do from home? For example, I want to keep my kidneys as healthy. Maybe I have been diagnosed with kidney disease as well. There are no herbal things to take that actually help alleviate the problem?
No. There are no herbal medicines that can cure diabetes, that can cure high blood pressure, that can cure kidney disease, that can cure cancer, that can cure heart disease as well. Because remember that, I know there are some people who will come up with conspiracy theories that yes, the West and the pharma companies are just making you take these medications, and these medications have side effects, and it will perpetuate your kidney disease and worsen your hypertension and worsen your diabetes. That is not true. Okay? If there were herbal medicines that were curing this, then I'm sure, everybody is smart. People who just take this and get cured. But I've had real life case scenarios where I've been handling somebody with diabetes and high blood pressure, and then somewhere along the line they meet a herbalist who tells them that he can cure this, and they stop, and he advises them as well to stop checking the blood pressures and the blood sugars, and he gives them concoctions, and they come back 2-3 years down the line with heart failure or kidney failure or a stroke. Mm-hmm. Yes.
All right.
So these things are real.
So no amount of juice therapy or blended concoctions is gonna work?
It does not work out. The important thing is to keep yourself well hydrated. Mm-hmm. Always. Mm-hmm. Yes. Always keep on, especially if you're diabetic or hypertensive, monitoring your blood sugars at home, monitoring your blood pressures at home, exercising regularly, regular checkups with your doctors, and being compliant to medications.
All right. Something else you mentioned is the fact that people take a lot of over-the-counter medication. Now, on top of that, there has come a new crop of people as well who are selling detox therapies and aloe vera juice and all these other types of detox things. Do we really need this, especially for weight loss? I have seen people who are actually selling those detox therapies.
We actually don't need any of that, and some of these therapies are quite harmful. There's something called the keto diet, and I've had patients admitted because of that. Yes, it's actually quite serious as well, and a lot of people are going online and checking these things out and then starting them off, and then they actually end up quite sick and ending up in the hospitals. So as I told you, most important is to eat healthy, and I always advise my patients that always divide your plate into two. The first half of your plate is supposed to be filled with vegetables, the other half you divide it into two again. One is proteins, the other one is starch, and always start with the vegetables first. Number one. Number two, so that you get full and you don't eat more of the starch and the proteins. Number two, always exercise. Try to avoid using lifts. Try to avoid using your cars. Brisk walking every day for at least half an hour. Make it a routine, and you'll see that eventually, yes, you do tend to get the weight that you so desire through that. There's no magic trick to that. I mean, it has to be done through hard work. Of course, there are those very obese patients, morbidly obese patients who are diabetic. Those ones we do recommend what is called bariatric surgery, but that is under the supervision of a consultant.
Okay. You mentioned keto. What is so wrong about keto diet?
You see, the keto diet has been there for quite some time now, and people have actually modified it quite a bit, and there are those extremes, and I've seen patients who do the extreme keto diets actually come with quite a bit of medical conditions, and they actually have to be admitted and rehydrated, and
Right. Okay. Thank you so much, Doc. I think we will require another episode, just to be able to understand, because we've talked about dialysis now, and when you spoke of end-stage kidney disease, there is need for transplant, So I think next week we can continue with this conversation, but you guys are gonna have that conversation next week. My name is Tracy Makami, and that's all the time that we had for Body Garage today. Remember, you can send in your questions, your feedback as well at TV47 Kenya on Facebook. On Twitter, we are at TV47KE, and until next week, stay safe, enjoy the rest of your week.